Okay, so one of the things that I was doing a little bit of like research on, and it kind of made sense for me because I have 6 kids. So I know that like having a lot of children or even just one child
Mm-hmm.
can do a lot of, it does a lot to your teeth. So explain that a little bit.
Yes. So when you're a woman and you're like a factory, right? You're going to produce a little baby. So the baby is going to need bones,
Wow.
calcium, the same vitamins. You're going to be the source for that baby to grow and become a human. So what happens is that it's really important that teeth are organs as well. So we're competing with the baby, right? The teeth need calcium, vitamin D, minerals. So it's extremely important that when a woman is going to have a baby or is already pregnant, that she is going to increase actually the intake of things that are going to be needed by the teeth and the baby.
Wow.
Because the outside of the tooth is equivalent to the outside of the baby, right?
Wow.
It's called the ectoderm.
Okay.
So the enamel needs calcium, minerals, and the vitamins D's and all kinds of vitamins. So the foods that are very rich in the components of the teeth are the things that you have to do. So you want to do extra hyaluronic acid, extra collagen, extra calcium. And one of my favorites is moringa because moringa has 22 amino acids.
Wow.
And you can do it in capsule form. And it has all the iron and the calcium that you need.
Okay.
It has more calcium than any cheese or anything that people can think that, you know, it can have. So that's one of the nutrients. So every time you have a baby, sometimes I have patients that every time I have a patient that every time she would have a baby, she would lose a tooth.
Really?
Every time. And I would say, but you gotta like eat properly.
Yeah. So is it true that if you don't have enough calcium or you're not taking that supplementation that you need to sustain the baby, is it true that the baby can actually take it from your teeth?
Of course.
Wow.
Of course. So I have a patient, for example, she's not pregnant, but she is postmenopausal.
Oh, wow.
So what happens is the woman that's postmenopausal doesn't have the hormones to retain the bone, the calcium, and all that, the collagen.
Okay.
So if I do a bone implant on a woman that I do an extraction that is postmenopausal, the body's going to take that because it needs it somewhere else.
Wow.
So I say you got to be on bone up in certain supplements that are going to give you what you need. But you know, as a woman, if you're planning to have a baby and you have mercury fillings, please take them out before you have the baby. Yeah. So you have a baby that's not going to have attention deficit or some neurological cognitive problem. Another thing is your gums. Your gums have to be perfect because if you want to have a low weight baby or a premature baby, that's the easy way. You have gum disease, gum infection, pus coming out of the baby is going to be born premature. Recently, I had a patient, she came before being pregnant, and I said, please get your infection out. She's young, she's in her 20s, but she has moderate periodontal disease. Wow. And I said, please get the abscesses out, but she did not listen to me. So what happened? The babies were born premature. Really? The infection in the gum causes heart disease. So one of the babies, they were twins. Oh. One of the babies had a heart condition, and the babies had to stay in the hospital 3 months because you know the heart condition and the low, and all that is so preventable. But there's not enough information about pregnancy and gums. So I thank you for that question.
Yeah, no, honestly, like when you read, I did a lot of reading before I became pregnant for the first time, and the information is so superficial. The only thing it says is, oh, make sure you get a cleaning at least 2 times during your pregnancy. But like, what is like where? Yeah, and what is the reason for it? Because if you're more educated, then you can understand. Okay, I need to take all these minerals and things. I need to really be conscious of doing that for my baby's sake, also for myself, so I don't lose the teeth after every child that I have.
Yeah.
Yeah.
Well, you know, I just want people to understand that if you have periodontal disease, that is a type of bacteria that causes inflammation in your gums, eats the bone, travels to the heart, travels to the lungs. When you're speaking to your baby or you're breastfeeding, the baby's getting all that, all that bacteria. So if a woman has periodontal disease, she's spreading it to the children. Wow. You know, it's same thing with the man. You know, I had a family that came and he had advanced. I said, you got to bring your wife.
Yeah.
She had advanced. I said, you have children? They said, yes, we have 2 children. I said, bring your children.
Wow.
I don't treat children, but
Yeah.
8 and 10. They have periodontal disease, massive
Wow.
infection, bleeding everywhere. And I said, how can an 8-year-old and a 10-year-old have a condition that's so advanced for their age? And thank God, that saved their family.
Wow.
They're
that's
alive,
amazing.
you know, that could
Yeah.
kill both of them. And then
Wow.
you have 2 orphans. Like, people don't understand your health is your wealth.
Yes, it is. That's very true.
Yeah.
Yep.
Thank you.
That is everything.